There is a category for fourth degree, but it's very rarely used because they go through every single layer of the skin
Mm.
down to the bone sometimes. And they're not painful because they've destroyed all the nerve tissue on the way down. They're curiously unpainful, but there may be pain as the nerves start to regenerate. So through the healing process. That type of burn could be waxy and white. The skin could be charred or dark brown. There may be blisters or flat blisters that look very dark that don't curl up into a blister. Complications from that can be shock, infection, tetanus, hypothermia. So when people are very badly burned, they lose a lot of heat through their skin. So their body can actually become hypothermic, and they lose a lot of fluid from the surface of the skin. So they can have hypovolemic shock. So first aid for first and second degree burns are pretty much the same. You're going to cool it, cover it, give remedies, keep an eye on it, and then make a wise call, like use your discernment and make a decision as to whether you can treat that at home or you need to go get some help. So, first aid for a third degree burn is not something you should do. It's not something you want to do at home. Get that person to the hospital, and you can help with recovery afterwards, but after the patient's been stabilized, especially using, which we'll talk about these, cantharis and causticum. Hopefully that gives you some background. And then as we talk about the remedies, Melissa's going to do that. And then you have a place for those when you think back on the treatment.
Yeah. Awesome. Thank you for that, Bree. That was really good information. And what we'll start with is arnica, which you would give at the very first in the beginning of a burn for the shock. So it might help the burn, but it probably is not going to help the burn too much. We really are addressing the fact that there was a shock. Right. Anytime you get burned, it's a shocking situation. If it's just a little first degree burn, you touched a stove, or the child touched a stove and they jump back and get burned, I wouldn't worry too much about arnica with that. I would just go right into the burn remedies. You can take it case by case, but for the most part, especially the more severe the burn is, the more shock that there was. And so arnica, I would give a 200C. And you could give it several times. You might even choose aconite. You might consider aconite, and I would give those one of those a few times if needed before starting the burn remedies. They might just need one dose, but addressing the shock can help them to heal better. So we're looking at, the mental emotional, let's get that calm. And you'll see some of these remedies that we talk about the mental emotional condition of the person. When we get them, their mental emotional picture calm, then they can heal better. The first burn remedy, my favorite, is cantharis. You could use a 30. I really do like a cantharis 200 in an acute burn, but cantharis is a Spanish fly, and this can address any burn. So it's my first go-to. Make sure it's in your first aid kit. Make sure you have it with you. And you can just use cantharis without even thinking. It can address any burn. You can use it for first degree, second degree. You can even use it for third degree burns on your way to the hospital, right? It's just one of the best burn remedies. There might be blistering, swelling, a lot of pain, burning, tingling. Cold water feels better for this person. They want to put a cold cloth on the burn, or they want to stick the burned part into cold water. And as soon as the water starts to warm up or the cloth starts to warm up, the stinging pain comes back. So then they want to hurry up and cool that again. So they want fresh cold water or a fresh cold cloth. So they keep asking, can you cool this off again? Cool this off again? Because as soon as it's not cold anymore, the pain comes back. So cold is immensely soothing, and it actually does help clear the pain quite a bit. Urtica urens is the stinging nettle, and it's a remedy for more minor burns. You can find some creams that have urtica urens in them, and you can use those creams topically if the skin isn't broken. So it's useful for, again, those minor burns, the topical burns. The skin will be hot and red. And again, the skin should not be broken or blistered if you're going to use a cream on it. So if it is broken or blistered, you want to use the remedies by mouth instead of putting a cream on. You can use urtica urens for first degree burns where there's no blistering. The skin is not broken, but it's red, hot, and uncomfortable. And it might be a little bit itchy. So it's also useful for severe sunburn. and scalds from hot fluids. So the person might prefer something a little warm on their skin. The cold feels too cold. They don't like it. So sunburns with intense burning and itching, you might choose Urtica urens in a 6X. So the lowest potency you can get is what you want to start with. And then causticum. Causticum is great for the 2nd-degree burn, even the 3rd-degree burn, again, on the way to the hospital. So although you'll usually be helping a person afterwards for the ill effects of a burn, of a 3rd-degree burn, you might choose to give some causticum on the way, or you might give the cantharis and causticum alternating after they get stable to help speed the healing. And it can take away a lot of the pain. These two remedies can take away a lot of the pain. So this is a burning raw pain. The person might feel quite tearful, and it's very good for helping burns to heal. Even somebody who has a really severe burn and they're in the hospital, then you can think of causticum for those people who are in the hospital for a long time with burns. They might have even had skin grafts, and this remedy can help them recover. Arsenicum album, most people know arsenicum has burning pains, right? Anytime we think of a burning sensation in the body, most of us think of arsenicum album. This can be good for a serious burn with a lot of pain. A big keynote of arsenicum is restlessness due to anxiety. So they're moving, they're pacing, they're moving from place to place, and they're pacing because they're worried. They might be scared that they're going to die because of this burn, or because of what's happening. They might be scared that it's not going to heal. They get really worried about their health condition. Arsenicum does not like, the person who needs arsenicum does not like to be alone. They feel really cold, they're chilly, they might even say they're bone cold and very tired. Arsenicum has a lot of weakness and just tiredness. They don't want cold on any part. They want warmth.